So Allies for Health and Wellbeing, we just celebrated our 40th anniversary, which is a huge milestone. We're based in Pittsburgh, and we were one of the very first nonprofits in the country to exist that focused on services for individuals living with HIV. So it sounds like not many of you are using HRAs right now. And so like you, about 16 months ago, I was in the same boat. I really had no idea what an ICHRA even was, had never heard of it. I knew that every year when it was time time for our benefits renewal, I stopped sleeping at night. I didn't know how to balance our budget. We have a very high usage employee population. We have a lot of people that have very complicated medical conditions. We also have some very older employees, as well as some fresh out of college. Every year we were, looking at like a 20% renewal on our health plan for the first couple of years that I was the CFO here. And then last about, 14 months ago, we have a June renewal. Our renewal two Junes ago, we were looking at a 47% renewal from UPMC. And this was not, sort of UPMC, that's our the largest health plan in Pittsburgh. This was not them being a bad guy. They were a partner to our agency. They give us tens of thousands of dollars to our annual fund every year. They have doctors in our clinic. So this was really just them coming to us and saying, hey, look, we're taking a loss on you because your employees are using our plan so much. We've been footing these losses for years and we can't do it anymore. So you are going to have a 47% renewal from us this year, and it's going to be 47% every year as far into the future as we can see. So this was about, 6 weeks before the end of our fiscal year. I already had the budget completed, and now we were looking at about a $500,000 shortfall in our budget suddenly, and I had no idea what to do. The C-suite was meeting every day, sort of in a panic, what to do. We could either, we had a few choices here. The first option would be to drastically cut the benefits for our employees, knowing that, as a nonprofit, our employee salaries were not very high. They were lower than they would have been in a comparable for-profit setting. And so some of these employees, especially ones with really significant health issues, this was going to have a real impact on their health. They might not have been able to afford the types of treatments that they needed without the benefits that we were offering. So then we were like, okay, what else can we do? We could cut entire programs. Some of our programs, are not as utilized. Maybe we're trying to think through these things, like what can we cut? Should we cut the hours of our health clinic? Do we need to get rid of our food pantry? What can we do? Or do we need to lay off staff? That was the other option. What do you do as a nonprofit when you may not have the option of a for-profit company to just, okay, well, let's just bump up our revenue. Let's increase our revenue. If you're tied to government contracts or donations from foundations, individuals, it's pretty tough to drastically increase your revenue at the drop of a hat. So we were looking at all the different ways to cut costs. When our benefits broker contacted us and said, hey, we know you're really struggling with this. Your UPMC came back with such a high renewal. Have you guys ever heard of an ICHRA? And I was like, no, I have no idea what you're talking about. I don't know what that is. And they started to explain to us, this is a way that you can get out of the employer-sponsored health insurance roller coaster every year of like, oh my gosh, what is the renewal going to be? Every time an employee, came to me like, oh, I'm pregnant. I'm very excited for you. But in my mind, I'm also thinking how this is going to increase our renewal again. Instead of being able to focus on our employees as employees, you're looking at employees as medical risks as well, which is not what you want. So we started talking to our broker about the ICHRA, and they recommended that we speak with Take Command. We talked to a few other agencies as well that offer ICHRA services, but Take Command for us was very professional, very friendly, very easy to work with, and we really felt like they cared genuinely about our mission. They do focus on nonprofits, so they were a clear partner for us. We looked at what the prices would be, and I truly couldn't believe what they were telling me. I thought I was sort of like someone was pulling my leg. As a CFO and an auditor for 15, 20 years, I'm very untrusting of things that sound too good to be true, especially when it comes to my organization's finances. But with the ICHRA, we're going to be saving, that year our renewal with UPMC was going to be about $900,000 to cover our health benefits, to keep the same level. Actually, it was a reduction in health benefits, but a level that we still felt we could deal with. That was going to be $900,000. When Take Command gave us our first quote, the quote that they gave us was around $300,000. After looking at everything, we ended up actually choosing more robust benefits. I think they gave us a quote for like covering all of our employees and children with a silver plan, and we were like, hey, we're saving so much money, why not go up to the gold plan? And so we did that, and we still saved $500,000 that year, and we were still able to offer the same benefits, the same level of benefits to all of our employees. And again, I'm sure some of you out there are thinking, I don't really believe it. It's probably not going to work for me. And it might not work for every single one of you. It would depend on the pricing in your marketplace. But for us, it kept us from having to cut the services from this agency that's doing so much in our community. So from the time we made the decision to switch, which honestly wasn't much of a decision, it was like, this is the only thing that we can do to not impact our mission and not cut benefits drastically. So we were working with our broker. We met with Take Command. They gave us a lot of options of what the costs could be. It was very simple on our part. There was very little for us to do as far as the initial onboarding. We basically had to download some census data from our payroll and give it to Take Command, and they ran a bunch of different scenarios for us, different cost levels. We decided, again, based on our budget and what we could afford, how much that we were able to offer our employees for a benefit, and then Take Command sort of took over from there, saved us a lot of time and administrative labor in working with our employees. We communicated with the employees, but Take Command also is willing to meet individually with each of your employees to talk with them about the process, help them look at the platform, choose one of the individual plans that will work for them. And and now that was, again, last July, a year or so ago at this point, and we had to do a 6-month renewal in January, so that was our first full renewal, but it went very smoothly, and none of our employees are really having any issues. They're very happy with the options that they have now. Instead of us telling them, hey, this is the one plan that we're offering, this is the plan that we're offering you, super healthy 22-year-old, and this is the same plan that we're offering you, 60-year-old with a plethora of chronic conditions. That's not existing anymore. They get to go out there, look at the plans that they want that works for their needs, their financial situation, their family situation, and their health goals, and they get to make that choice themselves. So yeah, for us, we saved, again, the first year, we saved $500,000 based on the renewal that we would have gotten with our group plan for the current year. We're on track to save $1 million this year as well. And I know that when renewal time comes around, it doesn't matter if my employees have had surgery, if one of my employees was in a car accident, what the costs of my employees' care is, that I don't have to stress about that anymore. I don't have to, stay up at night wondering, oh my gosh, what's the renewal going to come in at? Is it going to be 20%, 30%, 40%? How are we going to pay for this? When are we going to know? All of that, sort of risk and uncertainty has been taken off of my plate through Take Command and the ICHRA product, because it allows us to decide, as Tanner mentioned, it's more like a 401k. We decide what we're going to contribute, and then it's really out of our hands. It takes all of that risk and uncertainty out of it. And for us, our employees have been very happy with the change because they're able to get the same level of benefits, if not better. They have more choices in their healthcare. They can choose a different provider, a different plan. They can make their own decisions about what they want as far as deductibles and co-pays and co-insurance and any of those different options. They can organize it and cater it to their own personal needs. And with the savings that we've made, not only are we able to offer better benefits to our employees, we've also taken some of those savings and also increased the HSA and HRA contributions to our staff as well. So it's been a win-win-win really for us, for our employees, and for our clients, because all of that money has enabled us to further our mission, keep providing the amazing services that we're providing in our community.